All right. So before we kick off, I'd really like to acknowledge the traditional owners of the lands that we're meeting on. So for me, I'm on the lands of the Awabakal people, and I'd like to pay my respect to elders past, present, and emerging. So, hello everyone. Thank you very much for joining. Welcome to today's referral management webinar, proudly presented by Global Health. Referral management is actually a big deal. And if you're tired of wrangling referrals, losing faxes, and we've all heard those stories, dealing with delays in getting your clients or your patients the care they need, you're in the right place. We've got lots to show you. So today, we're here to help you find a better, simpler, more connected way to manage those referrals. Through this session, we're going to show you MasterCare Referral Management and how ReferralNet streamline your referral workflows, from sending and receiving secure messages, to tracking the referral status, to integrating directly into your existing care systems. And you'll see how we can help you to reduce manual effort, triage those referrals, whether you're a clinician, whether you're an administrator, whether you're part of the support team. Our goal today is to show you how technology can take the stress out of referral management. So you can focus more on care and less on admin. So we'll start with a quick overview of some of the challenges that we see. Then we'll go into a live demonstration and Q&A. As we go, please put your hand up if you've got a question. Enter it into the chat. We'll respond as we go. If it's going to take a little while, we may leave it to the end, but we will answer your questions. So, introducing the team. I'm Tanya Felton. I'm your host for this session. With us, we have Phoebe Hunter, Business Development Manager. Phoebe is going to be doing our demonstration, so taking you through how our referral management solution works. We have Elwyn Lim, who is our Chief Delivery Officer, Damon Gronveld, who is our Chief Technology Officer, and Matthew Cherian, who is our Managing Director. So that's the team. Let's go. So referral management is part of our MasterCare ecosystem. And MasterCare connects every part of the patient journey. So from community health to mental health services to specialist allied health services to hospitals. It ensures that data flows safely, securely, and efficiently between care teams and between partner organisations. So built on HL7 and FHIR standards, MasterCare Plus integrates with other leading health systems, ensures interoperability, compliance across the Australian digital health landscape. So this image actually shows what modern healthcare should be. So that's connected, coordinated, client-centred, wraps around the way clinicians work, wraps around the way a patient works, making sure that information flows safely. And as we go, we can configure clinical workflows, improve the way care is coordinated across all of the environments that you have. Our integrated platform, referral management, client administration, billing, funding, clinical documentation, reporting, analytics, appointments and scheduling, all of those available, all of those in responsive technology. So regardless of the device you've got in your hand, the form factor, what you see on your screen suits the device. So no crazy cutoffs. It looks as though it flows. It does absolutely work with lots of other things out there. So if your referrers still have faxes, we integrate with GoFax. So it takes the uncertainty out, and there's loads of stories about faxes going to the wrong person, the wrong organisation, and doing that too often. So we don't care what's in the message. We don't care how big the message is, whether it's pathology results, whether it's images, whether it's radiology results, discharge summaries, letters. And 10,000 plus healthcare providers are using this today. So this is a little snapshot of what you'll see. This is the referral management home screen, shows you the triage status of where the referrals are, where they're going. And there are lots of referral pathways. So streamlining it, making it lots easier than it is. Practice management systems using ReferralNet, heading to an administrator, clinical intake, allocating it to an inbox, allocating it to a team, allocating it to the correct intake person, and then closing the loop and sending it back, sending an acknowledgement back to the referrer. Has this been accepted? Do we have it? Or are we saying no? So we've got that closed loop. There's no questions. And then we can get really specialized. So whether it's coming from a GP or another referral system, going to orthopedics, urology, oncology, whatever specialist department, we can manage it through. And the same triage, additional triage. Do we need more people to take a look at this? Do we need to escalate? And then communicate the result back with a GP. So triage, let's close the loop.
So this is MasterCare Plus. I'm actually going to take you through Digital Front Door first of all, just to show you another way that you can receive your referrals and how this would work in the referral management. So we have the Digital Front Door, which some of you may have seen, some may have not. I won't go through the whole platform today, as we are limited on time and referrals is our main focus for today. But within the Digital Front Door, you're able to use this platform to receive referrals. This could be through self-referrals. You could send a form to GPs so that they can fill out a referral via a digital form. And all of these forms will land in your MasterCare inbox and some of the data will pre-populate for you. So if I go into forms here, there we have a few examples here, and just bear in mind with all of the forms in Digital Front Door, you can create them to look however you'd like, and you can collect whatever information you want to collect. So these are just examples, and you would have full control over the form builder. So you'd be able to create them yourselves rather than relying on us to do so for you. So if we go into this one here, we have a healthcare professionals form. So also just bear in mind with these forms, although they are hosted in the Digital Front Door, you can embed these links in whatever you'd like. So you could put this link in a text message, you could put this link in an email, however you'd like to do it, you can. So we have an example here where we have mandatory fields. We're collecting the referring doctor's details as well as the client details, and then a bit more information on their health summary. We can also upload files within the form. So you could even have pictures uploaded into the form, or you could just have maybe a PDF uploaded within the form. And then you can collect signatures as well. So you can collect consent as well. These can be made mandatory. Any of the fields can actually be made mandatory, so they can't submit the form without having filled in each mandatory field. So another example, maybe a self-referral form, and I'll just go into here. It's a fairly basic self-referral form. You can make them as basic or as complex as you would like. So this is just how it would look for a fairly standard basic self-referral form. So as I said, those are just examples and you can make them look however you would like. So now when we go into MasterCare, we log in with our username and our password. If we ever forget our password, we can just click Forgot Password rather than raising a ticket. If we log in, we then select our team. So you may within referral management have your admin team and then your intake and assessment team. However you'd like to structure it, you could have as many teams as you like. You could have different teams for different services, however you'd like to do it. But for this, we'll go into the master team. I will also let you know as well with the teams, there are different roles and permissions set for each team and different permissions for each role as well. So you can get quite intricate with how you do that. Then when we come into the home page as such, we actually have our referral KPI widgets up here, which I will go through in just a moment. We then have new messages in the inbox, new referrals. Again, this is configurable to whatever you would actually like to see here. So you may have new messages in the inbox at the bottom and new referrals at the top, however you'd like to set it up. This one does have a waiting room, which may not be relevant in the case of referral management, but this is a demo site that actually has everything enabled on. So as Tanya said earlier, MasterCare is modular. And therefore, you can use this as a referral management platform. And then later on down the line, you may add in other features. So you may add in your e-prescribing, or you may add in diagnoses, that kind of thing. So you can really start to use the platform however you'd like to use it. So when I go into the inbox, this is where any of the referrals I receive will come into. So you may have different inboxes set up for different teams, or you may just have one central inbox, which the admin team look after, and then they assign the referrals to the correct teams. So I have an example here of a self-referral that's come in from the digital front door. But if you had a referral coming from GoFax or any other referral platform, where other platform that's come in via ReferralNet, it will all land here. So when I view this referral, I can then process the document. The system will then try and find the client in the system. And as we can see, Phoebe already exists within the system. This is the correct Phoebe. We just make sure that we confirm it is, and we press select. If Phoebe wasn't in the system, we could add her as a client there and then. So then we'll just select Phoebe. Also to note, when you're adding a new client off a referral document, especially if it's come from the digital front door, the name, date of birth, phone number, email address, and address will pre-populate when you create the record. So you actually only have to click save instead of typing all of the information out. We then match the provider. So in this case, it's just Hot House. So we'll just select that one there. But this would be set up with your actual address book of referrers that you receive from. We then classify the document type as a referral. This will then make sure that the referral lands in your referral widget so that you can process it through the referral pathway. And now we go into the client's record, into the referrals tab. If you have any high priority alerts set up for a client, they will pop out like this. You can also add them at any time or edit them at any time. So then from here, we can see the referrals for Phoebe. We can see that we've actually got one that's to be scheduled and one that's to be additionally triaged. I will come back to this section in a moment. So now when we go back to the home page, we can see we've got a number of referrals. All unfortunately are late because it's a demo site. In practice, you'd hope that most of them would be within limit. And we can go through each stage of the workflow just from here. So in this workflow, the master team will be the to be assigned section and the to be scheduled section and to be communicated to the GP because it's the admin team. And then when the referral is sent to be triaged and additional triage, it's actually sent to the intake and assessment team for this workflow. But this could be set up however you would actually use it in practice. So if we go here and we have Marge Simpson, actually, we'll use Paul Doe for this example. We'll open up Paul. We can view the referral here, can view any attachments. We could also add any attachments at this point as well. We also have the suicide referral flag as well, just at the bottom there. And now we can assign this referral to the intake team. We can also change the duration if we know the duration, and there's indefinite or custom, as well as 3, 6, and 12 months. We'll keep it as 12 months for the sake of this. So now we can assign this, and it's now moved to be triaged. So when I go into the intake team, we can see that we have referrals to triage. So Paul's is just here, there. It is late because it was late at the beginning, so therefore it's late for the rest of the referral workflow. But we can configure the time frames for how long is late. Maybe 3 days, maybe 1 day, however you work in practice. So let's open up this one to be triaged. So now the intake team are doing their assessment. They can view the referral here, review any of the attachments, very similar to how it was before, and they can accept, reject, or additionally triage or reassign. So let's accept this one, and we'll put the priority as routine, and we can add in any free text here as well. So we've accepted this one, and this will now go back to that admin team, or the master team in this case, to then schedule the first appointment. So if we switch teams, we go into the master team, and we have one to be scheduled. So Paul Doe here. Obviously, it's a little bit messy because we have so many in this demo environment, but you can see what you'd have to be scheduled. So now the admin team would call up Paul. They would book him in for his first appointment. I also forgot to mention along the side, you have these internal notes, which allows you to communicate with other teams or staff members. So if you're handing over something like that, you could just pop in a note here and save. And then we've added that note, and they can see that I left that note at this time on this date. And then if someone leaves one in response, it would add on top as well. So now we can schedule in the appointment. How do we notify Paul? We phoned him, we booked him in, we've added the first date of visit. If at this point there is no appointments available, we can add Paul to the wait list from here. We'll just schedule him in. So now, when we go back to the referral widgets, we have one to communicate back to the GP. So from here, we will open up the referral to communicate back to the GP, open it up, accepted, press accepted. This then pre-populates your template to send back. This one is an example of an acceptance of a referral. We'd add the title. It pre-populates a lot of the information. So this is just a template that you'd have full access to edit yourself. So you can have various different templates, which populates different data. You can also add in extra bookmarks if you need to. So there's bookmarks throughout the system for clinical documents. And you could add in, if you wanted to add in, don't know if we've got any for Phoebe, but we'll add in current diagnoses. She's got none, so we can't add them in. Maybe if she had some allergies, we could add in the allergies, and it will pull from elsewhere in the system, or alerts. I think Paul, this is Paul, not Phoebe, that's why. So throughout the system, you can add in these extra bookmarks to save you typing out information, but you could also have them set up in the template themselves. So you'd have different templates for different types of referrals, and depending on where you're sending this acceptance to. So we press accepted. And now that's sent back to the referrer that referred in. So you don't even need to put in the address of the person that referred in. It's already pre-populated that in for you. So it just saves extra admin of typing in information that's already there. So within the referral management recipe, you'll have access to the referral KPIs and the home page. You'll have your inbox and your sent box. So you can also view any sent items. Let's try and extend the date to see if we've got any. And you can actually track if things have been sent, if they've failed, if they've been acknowledged. There's a few different ones. Obviously, this is a demo site, so they may not have actually been acknowledged. But you can keep track of where any of those sent items are at. Then if I go into the client's file, you'd also have access to the client details, the referrals tab here. So you can actually add in any manual referrals here as well. So if you had a referral over the phone, or if someone did email you a referral, you could download that email and add the referral manually here and just upload the PDF of the email as a file. And then you just fill in the details yourself. Doesn't take very long at all. And that would then also add into your referral widget, so you can still keep track of where that referral's at all points. You then also have your clinical documents section as well. So we won't go too much into clinical documents today, and the other features as well. But you could, for instance, if you wanted to add an attachment, you could add an attachment from your computer. If you wanted to refer on, you could do as well. With a referral letter, you choose the recipient. This would be populated with your actual address book, of course. This is the one we have in ours. And again, just a template that you can send that referral on if you needed to as well. With all of the clinical documents, you have the option to submit for approval instead of just complete and send. So if you did have junior members of staff, then they may need to submit for approval before anything is sent out. So you do have that option here as well. Let me just leave there. I don't want to go too much into the clinical documents because we'll be straying away from the referral management. But if you did want to learn a bit more about what other clinical documents you can use, also just like the templates and like in Digital Front Door, you can actually create any clinical document that you would require. So any sort of case note or progress note template, any sort of care plan or any assessment you wanted to create, you can do, and you'll have full access to do that yourselves. And then the other tabs we have on up here, these are all part of MasterCare Plus, and they sort of complete the full EMR package, but we won't go into them today. So if you wanted to find out more, just let us know.
Phoebe, there's a question from Sharon asking about adding personalized signatures to letters.
Yep. So you can add signatures within the clinical documents, very similar to how there was a signature on the Digital Front Door. It's just a box that you pull in. Actually, let me just show you the form builder. We have a little bit of time. In terms of pulling in the actual signature in the templates, I believe you can, but it would just be as an image. So you could just add the image at the bottom, and you'd find it on your computer. So if you'd saved your signature, right, you just add that in.
And then you can have the fields for their name and the discipline, whatever. Okay, thank you.
So you just create the template and add it as an image, yeah.
Are they two separate functions to edit the workflow and to edit the widgets as well?
I suspect it is.
Yep.
I suspect that the widgets do relate to the workflow, but they may be two separate steps. So we will need to get back to you on that one.
Okay, no worries. Thanks.
Thank you. So we figured some questions would come up. And can referral management integrate with your existing PAS or EMR? The answer to that is yes. We have an integration platform and we have a secure messaging referral net, so we can actually integrate to just about anything. Can I set specific workflows for specialty groups, so fracture clinic, oncology, ophthalmic? Yep, we can absolutely do that. Workflows are configurable, so while there is a workflow there, we give you that as a base. You can absolutely configure that to suit your business. Can I use this with other EMR solutions? Yes. Using our platform, we can send referrals, we can interact with whatever's out there. So interoperability is a big deal. We recognise that. Are there any other questions?
Yeah, look, as you mentioned there, one of the more complex aspects of sending and receiving referrals is the interoperability between the different secure messaging systems. We're currently using ReferralNet, but most of the partners in our region, which is Sunraysia, don't use ReferralNet, so we have issues sending to them. Most of them are using HealthLink. It hasn't been a major problem up until now because they were also using Argus, but Argus is about to become end of life, so they've all moved away from using that and switched it off. I guess question is probably, and I know it's been spoken about before, but is there any update on ReferralNet ever becoming compatible with HealthLink, similar to how it was with Argus? Because we're sort of struggling a bit at the moment, and having to go back to fax and hard copy letters and so forth. So,
can I answer that? Just to give you an update, Dylan, we have actually done interop with medical objects and with HealthLink previously, but they're just snowed with a lot of work, so we haven't quite got the release dates on these things. But in the interim, we also have, well, number one is we're happy to roll out ReferralNet to your base and without any fee. We also have an integration agreement with best practice. So ReferralNet will be part of best practice within hopefully the next month or so. So there's a few things happening, but unfortunately everyone seems to be trying to do more with less. So the time to market is going to be challenging, I guess. So we've got best practice integration. We've got we've done medical objects one way, and they have replied to us saying that they've got too many other demands, so we haven't yet done it the other way. In other words, MO to ReferralNet, and the same with HealthLink.
And Dylan, if I could also jump in, sorry, if you could send me a list of those endpoints that you're struggling to send to, I can also look into whether they already have ReferralNet embedded in their system. They just need to turn it on, or if it's something we need to roll out, because some systems do already have ReferralNet embedded into them. They just haven't turned it on yet. That's the only thing.
Okay, yeah, I don't think most of those in our region do have ReferralNet at all, but they do use best practice, a lot of them. So what Matthew just mentioned could be, definitely of interest to us. That could really help us if that, does turn out to be the case.
Yes, if you send me the list, I'll be happy to look into that for you, Dylan.
Yeah, awesome. Thank you.
Thank you. Thanks. Any other questions from anyone?
So with the ReferralNet, if you wanted different teams in different locations to use it, would it have to be assigned and set up for those teams individually?
So each team can have a ReferralNet ID. So it's just an address as such.
Oh, sorry, I meant the referral workflow. Yeah, I understand the ReferralNet. Yep, we've already got that.
Yeah, so each team could have a referral workflow specified to them. Yes. With the forms as well on Hot Health, you can have the form going to the specific inbox. So for the specific teams, you may have a tailored form for each service, and then they only receive those specific forms. And then also with the referrals that come in from external parties, they would refer into that specific address for the specific service. So they only ever see the referrals specified for their service. And then if anything ever did go into the wrong inbox, I'll show you now, you can actually just reassign the referral from the inbox, reassign to a different team. So you'd say this isn't for my team. Let me reassign this to any of the other teams there. So you've got a number of options. Does that answer your question?
Yes, it does. Thank you.
Thank you.
Hello, Ian Colclough. Can you hear me?
Yes, we
sure can.
Can I ask you, how does all this relate in the work of the Digital Health Agency and My Health Record?
So
I'll let you take time. Yeah.
Yeah, I'll take the first part of that. It would relate to My Health Record only if you wanted to upload that referral to My Health Record. So the referrals come into the agency. They can go to whatever teams are set up to respond to that, and they would flow through and attach to the client or the patient record. So at the moment, My Health Record is taking uploads of discharge summaries, care summaries, pathology, other things. So it would be up to each of the providers to decide, what do I want to upload to my Health Record?
Yeah.
The functionality is there. So we work very closely with the ADHA. You know, the
We do.
SMB conforms to their standards. We use a lot of fire even internally. We use fire resources. And yeah, we've had My Health compliance for a few years now.
Thank you. Thank you.
So I think also to bear in mind with the referral management, it is a referral management module. So it is designed to assist with your referral management, but you can add on other features from MasterCare Plus if you wanted to use it more extensively. So you'd still have the referral management widgets and the KPIs, and you'd actually be able to do a full workflow from referral intake and then even the whole care, the care plan. And you can book in the appointments, you can do the billing, you can do the reporting. But today's webinar was just to focus on the referral management. If you wanted to explore more, because we do also have integration with My Health Record, and we have the discharge summaries that we can upload to My Health Record, but that's the full sort of EMR rather than just the referral management module that we've gone through today. So happy to speak to you, Ian, if you'd like afterwards, and maybe book in some time to go through in a bit more detail.
Yes, and just extending that a fraction further, does this go straight through to outpatient referrals and to hospitals, or are we just focusing on specialist, non-GP specialists and health care providers out in the primary and community health care sector?
It can absolutely go through to hospital outpatients departments. So if your intake means that, we can absolutely bring in referrals from whatever source and then have them allocated to the specific teams. So it could be a general, let's bring everything into the single inbox, but more likely it's going to be like a fracture clinic or a specialist department within the hospital or physio, OT. It could be anything. And we would set up those referral workflows, or you could set up those referral workflows to go to whichever team needs to be able to manage that referral, and then closes the loop. Yeah, go ahead.
If I can add to that, Ian, at one of our deployments, we actually pull the MRN from IPM so that we don't, if it exists, and we push the appointment or the referral to the appropriate outpatient clinic in Cerner. So we do it both ways. The PAS tends to be the source of truth for patients, and the Cerner happens to be the system used for clinical. Yeah.
Thank you.
Thanks, Ian. I guess we'll let you guys get back to the rest of your day. As always, if there's anything that comes up that you want to ask, please do email myself or Tanya, and we'll be happy to assist. And if you did want to book in a more in-depth demonstration, then of course email myself or Tanya as well.